Hey guys, I'm Shay and I'm a flight nurse paramedic.
Hey guys, my name is Kaylee and I'm a flight nurse.
And today we're just going to talk a little bit about what flight nursing is, how we got into this role, and do some fun Q&A. All right, so I knew that I really wanted to get into flight when I was in high school. I felt almost like it was a calling for me. I knew I just wanted to take care of people in some capacity. After I was mock interviewed by a paramedic, I realized EMS seemed really cool. And I thought it'd be fun to get to take care of sick people. A little bit of an adrenaline junkie, but it was more than just that adrenaline so much as it was feeling just fulfilled by caring for people. So I got into EMS. I started working as an EMT, and then I got some really good advice to go to nursing school because I was told that nurses would make more money than paramedics. Unfortunately, there is pay disparity, and that was really good advice because when I started as a flight nurse, I started out making $7 more an hour than my paramedic counterpart. So we work under the same scope, flight nurses and flight paramedics. We work under the same medical director, so we all get to do the same things. But typically, flight nurses do make more than flight paramedics. So EMT, nursing school, I worked in the ICU, I worked in the CVICU, I worked in the ER. And then after 3 years, I got my first flight job and started flying. And I've been doing it for about almost 6 years now, 5.5 years.
I kind of like you. I went to college in 2015. I got my basic EMT. From the time I stepped foot in the back of an ambulance, I knew that I wanted to do some type of emergency medicine. I'm a third-generation RN, so I was already on the path to going to nursing school. Fun fact, though, I don't even know if you know this. Right before I was to apply to nursing school, I told my parents that I was dropping out of college and I was going to paramedic school. Yes, ma'am. Yes, I did.
We live the same life.
and my mom was like, no, ma'am.
No, you're not.
So here I am. I finished nursing school. Actually, before I finished nursing school, I got my advanced CMT. So I'm right in between a medic and a basic. Graduated with my nursing in 2018, went straight into a very fast-paced ER, although it's not a level 1 trauma center. We were able to see...
You guys see a lot of trauma, though.
Broad scope, yeah.
So much.
Actually, 1 year we had more traumas per capita than any hospital in the state. So one thing that we were good at, it was trauma.
Yeah.
So I got to see a lot of things. My decision from wanting to fly came from day one of nursing school. My best friend passed away. During that, it happened over a 3-day span. She was in the CCU at St. Vincent, and they were trying to get her to UAMS because she was a multi-system organ failure. And I remember I was back there. The paramedic and the EMT came in to transfer her, took one look at the monitor and said she's too unstable.
Mm-hmm.
And at that moment, I was very, very angry. But now, where I am now, I see why they did that. And if I was in their shoes, I probably would have done the same thing.
Mm-hmm.
But I knew then that I wanted to be the best that I could be in that field, and flight nursing was it. I mean, we fly some pretty sick patients. We're usually the last resort, other than surgery or some magical intervention that we can't do.
Yeah, that we're trying to get them
Yeah.
to. Yeah, exactly.
And then she passed away the next day, and I made myself a promise that I was going to fly. And so I went to the ER. I started pursuing my flight career in October of 2021, and I got hired last December.
Well, I think she'd be proud of you if she could see you now.
Mm-hmm.
How old was she?
She was 21.
So was she in college or?
Yes, she was actually about to graduate from getting her occupational assistant degree.
Aww.
We met at diabetes camp when I was 12. She was 13. We were in each other's lives. Like, it was a very special bond. Every Thanksgiving and Christmas, we would switch whose house we would go to.
Aww.
So we were really, really close. She also had rheumatoid arthritis, so she was in physical therapy a lot, and so that's what drove her to do that. She was great with kids, especially special needs kids. That was her niche. She was very, very good at it.
Well, I appreciate you sharing that. I think she would be super proud of you. So it was a ground crew that didn't transfer her?
Yes, it was a ground crew, a medic crew. So she had already coded once. They brought her back. Her liver was failing, her kidneys were failing. They wanted to get her to UAMS just in case she had to be put on the transplant list.
Yeah.
But they didn't know what was causing all this. They couldn't find the root of the cause. Everything was just up in the air. And like I said, this happened over a 3-day span.
Yeah.
After that, like, the doctors were still trying to figure out what was wrong. And I can just remember seeing the medic, and he took one look and was like, yeah, no. Yeah, it's like a double-edged sword when you're in that position. You know enough to know what's going on, but then again, you have a personal aspect that tends to cloud that.
You think if you had to take care of somebody you were close to now that you would feel too emotional, or do you think you'd be able to do your job?
There's a fine line with that. I'm very, I don't know if you can tell, but I like to be in control of situations. I would almost rather take care of them because I know that, not saying
and you know what happened.
I know what happened.
Yeah, exactly.
Or at least know the people that are taking care of them.
Oh yeah, totally.
I think that it would be very, very hard. But in the moment, I think that I could push it aside and do it. Now, after the fact, I might be an emotional.
Yeah. Oh yeah, that's when you come apart.
But
yeah, I think unless you've done it, it's probably hard to say like what you would do in that moment. You almost don't know.
She was really my driving force to be the best that I could be.
Awesome. I love that.
Yeah.
We're going to jump into some just general discussion about flight nursing. If it's your first time hearing about flight nursing or being a flight paramedic, typically it's someone that works on a helicopter or an airplane. For Kaylee and I, we both are rotor based, so we fly in a helicopter. And we have two main things that we do. We do scene calls, so that means a paramedic, a firefighter, a first responder at the scene of whatever kind of incident or emergency feels like that patient needs to fly, either because we have a resource they don't have or because they need to get somewhere really fast to get the intervention they need. So sometimes we do scene calls for medical emergencies, and sometimes we do them for traumatic emergencies. And then there are situations where there's a patient at a small hospital who's done their best to stabilize them, but again, that patient needs an intervention they don't have. They need to get somewhere quick, so they call us for critical care rapid transport. So those are the two main things that we do. Being in the medical field, obviously we're familiar with, paramedic scope, a nurse scope. That changes when you get into the flight side. But what do you think is one of the most misunderstood things about helicopter EMS from an outside perspective?
Definitely our capabilities, what we're allowed to do in the air. And granted, this is service-based and state-based for that matter. People don't realize how I explain it, especially for me personally in Arkansas, is that this is as close to practicing medicine as I'm going to get as a nurse. Yeah, because I'm at such an advanced level that people just, when I tell them like our capabilities of, we carry blood, we can put in chest tubes, we can intubate, they're like, wow.
A little mini.
We're pharmacists, surgeons,
RTs,
we're everything up there, and it's just me and you.
Just a little bit of everything, enough to try and keep people alive. Yeah, I think that's definitely one of the most misunderstood things. And because I'll even have people who, they know they're interested in flight, but they're still maybe like getting their EMT or working on it. And they're like, oh yeah, can EMTs fly? And for as much as we need EMTs, we need you in that role, we need EMTs and paramedic teams, there still isn't an understanding of the level, like advanced level that we staff on a helicopter. I mean, there are helicopters that staff doctors or nurse practitioners or PAs too within the country. I mean, you could go to the UK and usually I think they fly like a doctor and a medic. So definitely need that in a state dependent, a higher level of care, but it's critical care. So yeah, usually that comes with specific training behind it.
Thank you.
Okay, so next we're gonna ask. This is one of my favorite things to do. I always make my brother do this with me when we're filming or like getting together for family stuff. Ask each other questions we haven't seen, so that you have to give the answer on the spot. So I've written you 3, you've written me 3, and then I have a bonus one that we'll both answer because I think it'll be fun. Here are yours. Trade you.
Good.
Go first.
It's the biggest adaptation outside of learning a new skill set when transitioning from the ground to flight. Learning the aviation side of things. We are in charge of our safety, our patient safety. On the scene, we're responsible for paramedics and EMTs. So we have to be very, very familiar with our airframe, what our capabilities are, what we can fly in, what we can't, and basically forming our own opinion of what we're comfortable flying in.
Oh, that's such a good point. Yeah.
If you're first going into this, I was a little bit hesitant, especially down here in the South. Fly majority in the Delta, Mississippi, we have a lot of birds. Usually around this time of year, I like to fly higher. The higher we can fly, the better I feel.
Yeah.
I think that I will always be that way. I hope I'm always that way. I hope I never get complacent in that fact, because complacency can get you killed. But yeah, I'd say learning the aviation side was a big thing.
Yeah, there's such a burden to be at the top of your game medically, and that's our responsibility. But like first and foremost is to be a crew member, and to be a constructive crew member that can be a helpful part of the team and not a hindrance. Or you have to be a safety advocate. I love how you said like you're responsible for your own safety, because something I say over and over again, nobody can ever force you to get into the helicopter when you're not comfortable. I'd rather be on the ground getting questioned than
in the air and potentially lose my life.
Yeah, exactly. And then you guys are at my funeral. So yeah, 100%.
Another thing is regards to that, if something goes wrong in the air, and our pilot needs our help, like we need to know how we can assist him in getting to the ground safely, or
Yes. Oh, 100%. So you have this medical burden, and then you have the burden of, I have to learn all this stuff about aviation I had no idea about before.
Yeah.
Aviation terms, aviation safety, crew resource.
Yeah.
So like you're coming in as a brand new flight nurse, like, whoa, I'm really transitioning my skill set. Plus I have to learn all about aviation and safety. So
like how much fuel can your helicopter carry? How
Sure,
how big of a patient can we carry?
Yeah, exactly.
All that factors in.
Yeah. Yeah, that's such a good one. In your opinion, what makes a good partnership? I asked you a partner question.
That's the second one.
What makes a good partnership? I would say definitely give and take. The beautiful thing about partnership is you and I each have our own unique experience. Even though we may have both worked in the ER, I may have seen a patient you just haven't seen, and it's a 1 in a million. Or you maybe do something specific at your hospital that I haven't seen, and we can kind of lean on each other in those circumstances. But I think most of all, what will make a good partnership, other than you just being like a cool person to get along with, which is always a benefit, is when both partners take accountability for like their clinical knowledge, and they stay up to date on what's the safest thing, what's the best thing, evidence-based practice. I find that makes the easiest partnership, because instead of you guys debating anecdotal evidence, you can sit there and we can explain, I think we should do this, and here's the patho behind it, or the farm behind it. And you can sit there and give your reason, and then together we can decide if that's going to help or hurt. And more times than not, the partnership is so easy when both people are just up on like what's the best care, because we're not arguing. We're just, I know I'm doing this, you're doing that. We're knowing it's best practice, and like no one is acting like, well, I would rather just do it this way, just because I prefer it. And so I find that makes like the easiest partnership is just good medicine usually.
Yeah.
But yeah. And also just having a cool partner that you vibe with. All right, what you got?
Okay, name a favorite memory as partners. Well, probably it happened recently, actually.
You want to like I know what you're gonna say?
No, I don't think you do.
Oh no, okay,
no,
all right.
No. Our scene flight.
Our last scene flight?
The one before that, the rollover.
Why the
rollover with ejection? You remember?
We fly so much.
That was my first intubation that I got with you.
It
wasn't my first intubation ever.
It was the first one we had together.
But we have always, like, every flight that we've been on, like, it was just, it's always chaotic, but it's controlled chaos.
We have had really high acuity patients.
Yes.
Yeah.
Yes.
Yeah, exactly.
And this one was probably the one where I felt the most comfortable in my skill set. And I knew, it just worked. It was flawless, quite frankly. And
heck yeah.
It was pretty cool.
Yeah. That's a cool partnership moment, because, we've been flying as partners for a good amount of time, not the entire time you've been here, but for a lot of it. So you got to work with some other people before we became primary partners, and you have another, primary partner on your off day, and it just hadn't lined up that you had an intubation together, even though you're a year into your flight career. So that was definitely a cool moment for me to see you succeed, and it's like, that's what it's about.
And now we have always, on every call, even our first call together was flawless, and literally it was a scene flight.
Was it? Oh yes, yeah, it was.
It was a scene flight. I don't know. I guess we just clicked.
Was it a pediatric trauma?
It was.
Yeah, it was.
It was. And I think that we have just always just clicked, and we have always been so good about, okay, Shay's doing this, I'm doing this. If
Mhm.
Kaylee's doing this, I'm doing this.
Yeah.
And it might not seem to us like it's going very well,
Mhm.
but in hindsight, playing it back,
Yeah.
I was like, okay, that couldn't have gone any better.
Yeah.
Granted,
I
there's
think that's
always
true.
something that we can pull from
Sure.
and learn
Yeah.
from
Oh, yeah,
from
absolutely.
that flight, but it's pretty awesome. But
That's
yeah.
cool. Yeah, you're right. You had to refresh my memory for a second because we've been flying our butts
I
off
know.
lately.
Yeah.
I was like, what
I've
flight
taken
is that?
12 flights this month.
Gosh, yeah, it's so many. All right. If you could change one thing about your flight career, what would it be? Honest answer.
Honest answer.
I have noticed sometimes lose sight of what's really important,
Mhm.
and that's taking good care of our clinicians so they can take good care of people. And unfortunately, I have had experiences where I feel like the priority was not on like just taking good care of people and being safe.
Yeah.
And if I could change that, even in just my little bubble, because it's not always all the time, and it's not in every service either. But if I could change that within some of my experiences, I wish that just always had the emphasis on those things and not always on other factors, that run like the business side. And I
Yeah.
get it. It's a business. I get, to stay in service, you got to fly. I get that
Yeah.
part. But it's like as a new flight clinician, I had to learn. And then it's something I always try and like emphasize is your job is to be safe. Your job is to take good care of people. And I personally don't ever want to look back and look at a situation where I wish I had spoken up and
Mhm.
didn't. But I do wish that it just wouldn't have to happen. And
Yeah.
it does sometimes.
It can get clouded, especially when you're a new flight provider. There's a lot of pressure, and I still consider myself a pretty brand new flight provider. I've only been flying for a year, but it's like you can't gain the experience if you don't fly.
Yeah. Oh, yeah,
But
absolutely.
then again, is it safe for me to fly?
Mm-hmm. Yep.
Am I too tired to fly? Flying just in general, getting in the helicopter, going up to 2,000 feet, 1,800 feet, that alone is tiring in itself. Not
That's
just
a CFRN question.
Yes.
The factors of flight, literally vibrations that you experience in the aircraft cause fatigue and are a
Yes.
stressor of flight. Yeah.
not
Mhm.
just taking care of the patient.
Oh, yeah. Totally.
So that's something that I caution if you're not already flying, but you want to pursue a flight career, always, 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 make sure that you're safe. Yeah,
Totally.
you're responsible for you first and foremost. So
Yeah, 100%. And it's important to note that, like, you can fly for a safe company with safe rules.
Mhm.
You can fly for a company that advocates for it. And you can just have one outlining experience, maybe just with one partner or with one pilot that you wouldn't expect.
Yep.
And that's why it's good to not be complacent because you can get comfortable somewhere that things are normally pretty good. But you don't know. People change in and out all the time. And that's why you still always have to, like how you said it, be responsible for your own safety. So, yeah, 100% always be your own advocate.
One thing you will make sure to do when you become a flight preceptor. So I was a preceptor in the ER. I basically precepted my new grads like my preceptor did me because she was fabulous. I always wanted to create a safe learning environment because at this level, really at any level that you're new to, it's already stressful. Really, when you get to this level, it is very, very stressful. You feel like you constantly have eyes on you, and you do.
Yeah.
You are learning this craft, and your scope of practice just drastically changed.
Oh, yeah. And one mistake could be a critical. You don't have room for error as much.
Yeah, like you have to be on your game. So I just want to create that safe space, always have somebody. I don't want to ever make someone feel like that you can't come to me and ask a question and that it's a dumb question. The only dumb question is the one not asked.
There you go. I like that.
Just give them an opportunity to grow and not like, okay, you're in this flight suit. You are a representative of this company. You make sure that they know that they've gotten, because once you get to this point, you get hired. Okay, you've already proved yourself.
That's right. You earned your spot.
I think a lot of that gets skewed because a lot of people, when you put on the flight suit, they view it as an intimidation tactic. Okay.
Yeah.
You've got to remain humble, even at this level.
I have that discussion a lot. Like, just because you wear the flight suit does not mean that you're better than anybody else, or even, you know, a paramedic on the ground, because no matter what level you're at, there are always people that somehow get by.
Yeah.
Maybe they're lazy, or maybe they're not a
Yeah.
good partner, but somehow, you know, they get hired. And so, or maybe there's a ground paramedic who just has worked in critical care and has done more than you have. So you don't ever know who you're talking to put somebody down or seem like you're better than someone just because you wear lights. So I definitely agree. All right, last question for a bonus question. How do you separate your work life from your home life? I think there was actually a period of time where I used to work as a crutch, and I worked a lot.
Mhm.
And I think in our industry, we do that. We have very specific personality types.
Mhm.
And sometimes I think it's easy for us to find vices or use work as a crutch. As much as I love my job, I don't want to do it so much I hate my job either.
Exactly.
So I've always found that, like, I just still have to pursue my passion. Like, I need a day off. I need to go fishing. I need to go
Mhm.
snowboard. I need to go outside for a hike. And realize that, you know, if I became physically incapable of doing this job, but I put all my emphasis on this as my identity, who would I be without it?
Mhm.
So that perspective has always made me just appreciate the blessing it is to do the job now,
Mhm.
and not take it for granted, so that if there ever were to come a time that I wasn't, I would still have an identity and be okay. And I haven't neglected my home life so that there's nothing left for me to come home to.
Yeah.
So yeah, I think just taking the time off for mental health, because I think a lot of us are like, oh, I compartmentalize so well. I don't need to. And you do,
That's
yeah.
coping
You
mechanism.
do so well until all of a sudden you're like sitting there one day, remembering a call from a few years ago, and you're like, oh God, you know what I mean?
Yeah.
And your brain's like, you want to process this now, or
Yeah.
So yeah, definitely find that good balance.
Yeah. I figured that out during COVID because I was in the hospital during COVID.
Working in the
working
hospital,
ER.
yeah.
And burnout during COVID was real. It was really extreme.
Mhm.
You know, they were offering all this big money to pick up extra shift.
Oh, I bet, yeah.
And I mean, I can remember one year in February, I only had 7 days off.
Oh my gosh.
Yeah. So used to use work as a crutch.
Yeah.
It was a coping mechanism for sure.
Mhm.
Now that I've gotten into this job, into this role, I've had a lot more time to, even though we work 48 hours at a time, I think that we have one patient at a time. I mean, we
Mhm.
might do multiple flights back to back.
Yeah.
But there comes a time to where we can, at work, we can just calm down,
Yeah.
you know,
Do a little decompress.
think about it all,
Mhm.
you know, sit back, eat ice cream, Snickers bar, and all as well.
You know, always got lots of. If there's two things that are always in our fridge, it's your PB&J,
Yes.
your PB&J's Uncrustables, and Snickers ice cream bars. Thank you, Aaron.
Yeah.
But yeah, oh my gosh, there was a time during COVID when I was like, I love flying, but the COVID night, I mean it.
Looking pretty.
Oh
good.
gosh. All right. You ready for the bonus question? We have to talk a little bit of medical before we end it.
Okay.
All right. The diagnosis finding or sign that you think is the most missed or overlooked. And I mean that, like, pick whatever kind of patient you want to talk about. Now, it's not fair because I wrote the question, so I already know mine, but I'm curious what you say.
Oh, man. I think a lot of times, and not all flight services have this capability, but for our specific flight service, we do, just having a multi-system trauma patient and actually knowing what you're looking at.
Yeah, there's a big difference in having the tool and knowing how to use the tool.
Knowing how to use it. And I'm
Mhm.
not the best at it. Shay's pretty daggum good at it because they could be bleeding out before their vital signs show it.
Mhm.
And so getting on top of that, I
Yeah.
think that is probably one of the fun things that we don't use very often.
Yeah, even just like making sure that you're not being tunnel vision too.
Yeah.
Do you remember the call we had with massive facial trauma? Everyone was very distracted by it.
Yes.
And even though this didn't change her clinical care because it wasn't a tamponade, we found a pericardial effusion.
Yes.
And they were so just worried about like securing the airway and this massive facial trauma that they hadn't CT'd or scanned anything from the neck
Mhm.
down. And
We actually took her to the CT.
yeah, they're like,
before
hey,
we
now
looked
that
at
her
it.
airway is secure, can we look? But they only did a head CT.
Yeah.
Remember? Because they wanted to get her out of there so fast. So Kaylee and I ultrasound. I'm like, Kaylee, that's a fusion. It wasn't a full tamponade. It wasn't affecting her vital signs, but Yeah, she totally had a pericardial effusion from
Yeah,
what we
with
could
that
see.
with that massive of facial trauma, I
Mhm.
mean, there's bound to be other trauma somewhere.
Yeah, if you your face you might want to check the rest of it.
It just
Yeah.
just err on the side of caution.
Yeah. You can find me on TikTok, Clayton or Shay. You can find Kaylee on TikTok. What's your handle?
Lifesaver 24/7.
I love it. Yeah, and shoot us a DM if you guys have any other questions or topics that you want us to cover next time. All right, we'll see you then. Bye. Alrighty.